Hey guys, in honor of Blood Cancer Awareness Month, September, I thought I would give an update on my maintenance chemo situation because I always get asked questions about it, and yeah, I'm just going to explain it a little bit. So, in my case, I have to be on maintenance chemo for 2 years. I just finished 1 year, so I have about 11 to 12 more months of maintenance chemo. So, maintenance chemo is what you get after your initial high-dose chemotherapy. It's to keep your cancer in remission. Cross your fingers. So, I get 4 drugs. Once a month I go to the chemo clinic and they access my port and they give me Vincristine, IV Vincristine, and then also I go on a 5-day course of steroids. And then I take Mercaptopurine pills every single day at 2:30. I have an alarm on my Fitbit so I don't forget. And then I also take Methotrexate once a week, pills. So just 4 drugs. So the biggest side effects I would say is the steroids. Not necessarily when I go on them, but when I go off of them, I get joint pain, bone pain, and then I end up having to take pain medication, and then I end up having gastro problems like constipation, and then opposite, diarrhea. And that cycle just goes on and on and on and on and on. The other main side effect is overwhelming fatigue. There's a couple days out of the month where I just can't function. So that kind of sucks, but right now I'm able to work part-time. I have 2 part-time jobs. They don't equal a full-time job, but it's at least I'm making a little bit more money. But my journey through maintenance chemo has been tough. When I first started, I started on like the normal dose that everyone starts on, adults, I guess. And my immune system freaked out and depleted itself. So I went neutropenic and caught an infection, sent me right to the hospital. Got IV antibiotics for like 5 or 6 days, and I was fine. So they took me off the maintenance chemo for a couple months, and then I was put back on it, but they cut all the dosages in half. So then I was only getting 50% of the standard. So that was through fall semester. And then fast forward to spring semester, my liver counts were shooting really high, so they had to lower my Mercaptopurine pills, which is the pill I take every day. And then my immune system freaked out again because I was student teaching at elementary school with germy kids. So I ended up in the hospital with pneumonia. And then when I got out, they lowered all the dosages again. So now I'm on 25% of the standard. And also during the hospital stay, I got something called IVIG, intravenous immunoglobulins. Immunoglobulins are like antibodies that also help fight infections. So I got that. And then so they lowered it to 25% of what I started on, and that's what I'm on now still. My first question to my doctors was, am I getting enough chemo? Like, is it going to stay in remission? But they assured me that I'm still in therapeutic range, which means that it's still the chemo's still in a range that it's helping and it's affecting me. So that's good. But I'm literally at the lowest dose, so they can't really lower it anymore. So I've been on that since that hospital stay back in March or February. And ever since I got the IVIG and I've been on the 25% dosages, I've been pretty good. As far as my blood counts go, like my immune system is pretty stable, knock on wood. I made it to graduation, I made it through the summer, traveling without getting sick or even catching a cold, knock on wood. And then yeah, I made it to starting my part-time teaching jobs. Yeah, so I'm doing good. And that's my update. So see you later.